Welcome back to the Traders Network. I'm Michael Yorba, your host, broadcasting to you live from the Dallas KFXR 1190 AM Clear Channel Studios, streaming to you on iHeart app. And for our listeners who are outside the borders of the United States, yorbamedia.com. My guest today is Allan Miller, founder and chairman and CEO of Universal Health Services. Allan is really a super accomplished gentleman. He is, this is one of the largest and most respected hospital management companies in the United States. He's also founder and trustee of Universal Health Realty Trust Income, real estate investment trust specializing in healthcare and human services related facilities. Both companies are listed on the Fortune 500. Allan, welcome to the show.
Thank you. Thank you very much.
All right, my pleasure. That was a really brief bio. Is there anything special you'd like to bring out beyond before we get into our content today about you and your company? It's been on a massive tear. $74 a share in April, now $89. It's just somebody's buying the holy heck out of your stock. They love it.
The thing that I'm really proud of, and first of all, we have 66,000 employees. So I'm speaking for all of them. And their families, and it's just been good for us in that we have so many people that are well employed doing wonderful things. But one thing that's happened just recently that I'm very, very proud of for all of us, Fortune magazine has had the most admired companies for a number of years. We've been on that, well over 10 years, and this year, in our segment, we are the number one hospital company with regard to admiration from our peers. So that's something that we're very proud of.
Yes, and you should, rightfully so, you should be. Give our audience, if you can, just because not everybody knows you. I know that you're highly respected in your industry sector, but for those who haven't had a chance to look into the company and look into the stock, a brief, if we can, history of its founding back in 1979.
Sure. This is our 35th year, and we have a fine record of service to our patients. That's the reason that you've seen our stock go up without question. I mean, people trust us, and they are coming to our hospitals for service because they know that we're going to do the absolute best we can for them. And we've had a great record of success. We don't put up with any nonsense. Our staff is highly professional, and they're focused on treating patients. We're in 37 states. We will record revenues this year of about $8 billion. We're profitable, highly profitable. I think the thing that we talk about is doing things the right way. And I think we have a record of doing things the right way. And what I could tell your audience is that regardless of the hospital that they go to, that's a UHS hospital, and I've been a patient at different UHS hospitals, so has my family. We don't go elsewhere. They can be assured that they're going to get the very best treatment with the very best equipment, with a very professional staff. And the people who are dedicated to taking care of patients require the best in equipment, the best in facilities, the best in support personnel, or they'll go elsewhere. So good attracts good, and we function that way.
Yes, I can see that. Now, let me make sure that the audience gets a more in-depth view of what you just mentioned. 225 facilities, 25 acute care hospitals, and 195 behavioral health facilities, and 3 surgery centers. That is quite an accomplishment. Now, if we may, just touch on a little, if we can, just a little bit of the missions and principles that you founded the company that made you so successful. I want the audience and some of the other people who are aspiring to be like you to get a takeaway message from this, from a man who's actually been able to steer a ship successfully into the success zone.
Well, I think that we are concerned about patients, number one,
Right.
and patients number 2 and patients number 3. That's our concern. And if you do that well, you not only have a great feeling of satisfaction. I mean, if I get a letter, which I do, and someone says, I was besides myself, my son was with all these problems and this and that, and you solved them, or my staff in a particular hospital solved them, and they are dedicated, that makes us feel good. And what happens is people, as I said earlier, are looking for excellence, for quality. They're looking for people they can trust. And they know they can trust us. The communities trust us. And this is over 35 years. You don't fool people. But we're very pleased that in many cases we're out of beds because we just can't handle the number of people that are seeking treatment from us. So that's a great source of satisfaction. And by having that as our goal, our number 1 mission and our number 2 mission, all the rest falls into place. That's what we're here to do. And if you do that, we have been very successful beyond anything that we certainly set out to do. We didn't expect to be in 37 states or anything like that, but we have had people that have sought us out to sell facilities to us because they're retiring. We've had communities really campaign to have us build hospitals there. We're going to build another one in Las Vegas. We just opened one in Temecula, Southern California, last October. We're in the business of expanding because we are in growth areas, and that's really been our strategy.
Doug, the underlying message I'm getting there is you have got trust, you've got integrity, and you've got dependability. That's what I see as coming from that message. Now, let me turn this just a little bit, if I can. I want you to comment because this is a big factor for you. With an overview, briefly, we've got about 3 minutes left in this segment, but of the Affordable Care Act, the impact on the hospital management business.
Well, first of all, it's a positive for the hospital business. But as everybody knows, it was poorly administered from the outset, and the people have called it a mess, a disaster, whatever, which it was. It should have been done, could have been done better in terms of it's being set up. As of January 1st, 14, people have got to register and have insurance. Now, many people are covered by their employer, but there was a mandate that individuals and small companies and all have to provide insurance, or individuals have to go to an exchange and buy insurance, and that wasn't handled very smoothly. So there have been a lot of delays. But ultimately what we're looking at, and I think what investors are looking at, is that there are going to be many more people who've not had insurance, and so they have been reluctant, or they don't go to a hospital, and obviously emergencies, they come, but by that time many things may have advanced which did not have to happen because could have been avoided by earlier treatment. So these people will have an opportunity to go to a doctor, to tell them what the problems are, and hopefully a lot of problems could be avoided or ameliorated. So by having mandated insurance, and ultimately, the number, nobody's sure of it, but it's about 31 million people didn't have insurance that will get coverage through the program. Well, that's very meaningful. And we think we're seeing some of that currently in the hospitals. And obviously, when people have insurance, they are not into their pocket as much as they would have been where they had to pay the full charge. So they avoided hospitals. Now they don't have to. They can go to a doctor, and they can go to a hospital if necessary. So it's a positive thing. we may have a chance to talk more this morning about the VA, because I think the law is positive. It'll have a positive effect on hospitals. We believe it already has. It's showing some signs where people have coverage, and we're seeing an uptick in business. But the problem that I see is that if it goes down the path of socialized medicine, or where the government runs the program totally, we've seen the VA. The government runs the VA.
Allan, let's do this. Let's take a break, and I would like to cover what you're doing with your commitment to communities and, most importantly, the veterans on the other side of this break, all right?
Sure.
All right, we'll be right back with Allan Miller, founder, chairman, and CEO, Universal Health Services, UHSINC.com, and symbol UHS. And special thanks to Monk Media, 1-800-PublicRelations.com for all their PR and media support. We'll be right back with Allan Miller, founder and chairman, CEO, Universal Health Services. Welcome back to the Traders Network. I'm Michael Yorba, your host, broadcasting to you live from the Dallas KFXR 1190 AM Clear Channel studios, streaming to you through the iHeart app, and if you're outside the borders of the United States listening to our show, yorbamedia.com. All right, I am joined with Allan Miller, founder, chairman, and CEO, Universal Health Services, UHS symbol, and UHSINC.com. All right, Allan, welcome back to the segment. I appreciate you taking the time out of your busy schedule to be on our show.
Thank you, Mike.
My pleasure. All right, we were just about to get into this. You were starting to ramp up into this. Universal Health Services commitment to the communities that it serves, but most importantly, what's going on with our veterans and how you participate there. Can you open that up for us, please?
Sure. Well, first of all, I got a lot of training from the military. I was in ROTC. I was commissioned at graduation. I was never in a combat situation. I was a reserve officer, and now I'm retired. But I have a great admiration for the military. I have a great admiration for the people that serve, and we do a number of things at the company to support our wounded veterans. But and so the VA really, the scandal, whatever, has really troubled me greatly, and I just can't understand how this wasn't a number one priority for anybody in the office of the chief executive. But all right, put that aside for half a minute. This shows that government running a very complex network of physicians and wounded people and sick people and aging people, and I don't know how 1,100 hospitals or whatever, they can't do it. They don't do it well, and that's a fact. And whether it's politics or the bureaucracy or people without incentive, I'm sure there are a number of really well-meaning and good people who serve the VA, but the organization doesn't function. I'm not a great believer that government can run very, very complex things. It should be on the local level. I think they run the military, but after that, you have to question it. And, simple common sense says, why don't they give all of our veterans vouchers and let them go to the best hospital they can find? Why doesn't that happen? I mean, I understand at the end of the Second World War, and I'm not a student of the whole history of it, they had all these people coming back. We had 16 million people in uniform in the Second World War. Fine, so you had to set up a whole system. But now you have 5,000 community hospitals. Why don't they give these people who are the most deserving a voucher? Let them go wherever they want. I know. That would eliminate the system and all the people that work in it and all the bureaucracy. But do we want to serve the veterans the best way we can? Let them go to the hospital in their area that serves everybody else and functions where they have to perform. The VA, they don't have to perform. And I hate to generalize. I'm not a student of the VA, and I'm sure there are a lot of people there in the VA who are very, very heartsick about it, but it doesn't work the way it should.
Coming from a man who's definitely a titan in his industry, the link between military and business is, as far as I'm concerned, it is people like you that do make a change in the world. Are there any other lessons that we can talk about today for CEOs and business leaders they can learn from, say, our military leaders and give more structure, more success to what's happening in our industry sectors?
Have to hold people accountable.
Yes.
This is what I don't. Well, I'm not a politician.
Absolutely.
I mean, you got to hold people accountable. And if things don't go right, you change them. And everybody else in the organization says, I see, he didn't do it, she didn't do it. They're not there anymore. And that's a very, very important lesson. And, letting somebody go from the VA who was already announced his retirement and nobody getting canned from the IRS. And I mean, how can you run an organization efficiently with that kind of leadership and lack of accountability? I just don't understand it. I really don't. Go back to, something that just occurred to me. The Second World War. Eisenhower was in charge, okay? And they went into the war with a lot of people and the high ranks, generals and all, who'd never been in combat situations, never been in such a complex situation. And they got rid of a ton of them because they just weren't up to it. And the people who were up to it, they were promoted rapidly in the ranks. You can think about McClellan. He was the best soldier in the Army. And President Lincoln couldn't get him to fight. And ultimately, they found a guy who had a big cigar, and they said he drank a lot, and he won the war. I mean, it's the performance. It's not the other measures of things and who you know and whatever. You got to perform, and if you don't perform, you have to step aside.
Yeah. I agree with you. I was wrestling with that all weekend with some people I work with, and I'm going to take that to heart. I really appreciate that. There's got to be – give us at least one more nugget before we have to sign off at the end of the segment.
Well, I think the other thing, if people perform, then you have to reward the performers. And the important thing, and this is for you too, Mike, you said you're struggling.
Yeah.
The rest of the organization is looking. And – if you're in a position, as you are, of being in charge, the rest of the organization is looking, and they know. That's the other thing, Look, nobody likes to push people aside, to fire somebody, to downgrade them. It's such a terrible thing to do to somebody, and we recognize that, but you're hurting the organization because the rest of the organization knows. This is something I'm in my office here, and I only know what information comes in here. But the organization knows who's performing and who's not performing. And one thing I found out a long time ago, when you finally make your move, Mike, they will say, what took him so long? So, they know, and they're waiting for you to catch up. The people that work with those people or whatever, they see more than you will ever see. But when it finally gets done, they will say, well, thank heavens he finally did it, and what took him so long, because it's been hurting the organization. And the organization, is the horse that carries us all. You got to take good care of your transportation.
Yep. Thank you so much for that. All right, we've got about a minute left. Any parting message for anybody? And by the way, is there anything coming up on your agenda, public speaking events, that we can let the audience in on so that they can follow up and drill down into the conversation we had today?
I just think if they look up UHS, there'll be a lot of information. We have a website. I've been on the air a number of times. I've been fortunate enough to speak in short sentences and talk quickly, so and I don't get paid, so I'm the absolute wonderful guest for anybody with the radio or television. But I really would hope people would look at the website. There's a lot of information on there. And obviously they can see where our hospitals are, and if they are in need, I would welcome them coming, and I can assure them we'll do the best we can. The one thing I didn't touch on, we don't have a lot of time, is we have a program of servicing veterans in particular. We have facilities that are near bases, and we have rebuilt the hospital. We bought a hospital that wasn't up to our standards, that was serving the military, and we built a new hospital. We do a lot with the military. We've just put together an advisory board of very outstanding individuals, mostly generals, retired, Surgeon General of the Army, et cetera, and they're advising us on how to go about it. And, you know, I've been thinking about it this weekend. Maybe we ought to get involved in the VA situation. I don't know how, but it's greatly troubling to me that somebody with a problem has to wait on a line. I saw this woman whose husband died. I mean, it's...
Allan, we got to go. I want to thank you so much for taking the time to be on our show. We'll call you back for another interview to give us a follow-up on what you're doing with your initiatives.
Thank you very much, Mike.
My pleasure. You've been listening to Allan Miller, CEO, Chairman, and founder of Universal Health Services. Special thanks to Monk Media and 1-800-PublicRelations.com for all their PR and media support.